in my residency, one of the problems I ran into was actually how you define the term stereotypy. Because depending on what discipline you're from, veterinary background, ethology, applied behavioral analysis, psychologists, they all have a different definition of what a stereotypy was. So I was quite distraught through my residency because I'm like, they're going to test me on this during my board certification, and I don't know what a stereotypy is, and more importantly, I didn't know what the difference was between a stereotypy and an obsessive-compulsive disorder, okay? And I will tell you today, I still really don't know the difference because nobody has a good answer. So we're going to define it today for today's lecture, and again, depending on what background you come from, you might disagree, and I am happy to entertain disagreement because someday somebody will clarify this for me. So one of the things is I did go to the psychology discipline and say, well, how do they define stereotypies? Because again, zoo people, they have a different researchers that look into this. They all have a different interpretation. And some people use the term, stereotypy and compulsive behavior interchangeably. We're not going to do that today, although when we talk about stereotypies in horses, some of these stereotypies are probably actually compulsive disorders. And again, this is why it gets so confusing. So one of the definitions is a repetitive, relatively unvarying behavior sequence. It's a motor pattern because when you're talking about a repetitive behavior, the animal actually has to be doing something, all right? So we believe these are reinforcement-driven behaviors, although this gets confusing because one of the older, if you will, and sometimes even depending on the source, current definitions of stereotypy is a apparently non-functional behavior. But if these animals are doing this behavior over and over and spending quite a bit of their time budget expending energy in this behavior, it has to serve some function for them or they wouldn't be doing it. The problem is we don't know what the function is, so we just say it's an irrational, non-functional behavior, all right? I'm sure if we could ask them, they would enlighten us, all right? So when we talk about compulsive behavior, again, for today's kind of lecture, and this is kind of how I differentiate, I don't think all stereotypies are compulsive, and not all compulsive disorders are stereotypic. But this we're going to talk about as an out-of-context behavior, and again, apparently non-functional, although I have an issue with that part of the definition. It's excessive, it interferes with the animal's normal daily functioning. So the amount of time they would spend grazing, socializing with other horses, or looking for food, water, then the animal is instead spending time doing this behavior that, again, to us, doesn't appear to have some benefit to them. So in human medicine, compulsive behaviors historically have been defined as anxiety-type behaviors. So if you look in the old diagnostic and statistic manuals, they were clumped in with the anxiety disorders. But now that we know more about the neurobiology of compulsive behavior, that categorization is starting to be questioned. And we're going to talk more about the neurobiology in a little bit. Back in February, I actually went to a seminar and sat in some super fascinating lectures by a guy named Joe Lang from Chicago. I'm suspecting you people probably know about him. He does a ton of research on operant conditioning, and maybe not quite so into the medical model, but he had some interesting lectures about a phenomenon called adduction, where animals are under multiple contingencies, or people under multiple reinforcement contingencies, and basically sometimes these different behaviors get blended together into these contingencies, and you have apparently, again, irrational or a behavior that doesn't seem to be beneficial to the individual, but they perpetuate doing it. And even Erica mentioned things like, well, I can go and take a break from work and go get candy out of the candy machine, or I can go have a healthy carrot snack. And even though eating candy stresses me out because I know it's going to make me gain weight and not be healthy, I continue to do it even though I could go eat carrots. And so people have these discussions in their head, and they're like, well, I understand that this seems like a bad choice, but why do I continue to do it? And some of these behaviors are maintained by this adduction, and one of his hypotheses is that some of these compulsive type behaviors that we see in people and in even animals may actually be operantly driven by this adduction phenomenon. So in humans, when we use the term obsessive compulsive disorder, which we try not to say in animals anymore, and I'll tell you why, is this is a mental disorder where people have unwanted and intrusive thoughts or feelings. These are the obsessions. They're mental, all right? We can't see those. We can't observe those. And those obsessions drive a behavior, which is then the compulsion. So these are the things like you have an obsession about germs, and so you spend a lot of time washing. Or you have obsessions about, did I lock the door? And so you go back and you check the door over and over, like 50 times. Did I lock the door? And you count, all right? Or the checking things. So in animals, we don't know if they have obsessions. So currently, at least in the veterinary behavior discipline, we generally refer to just compulsive disorders instead of obsessive compulsive disorders because we don't really know what the animals are thinking or if they're actually having these kind of obsessions. So in people, there's also obsessive compulsive personality disorder, which is different. This is a general pattern of concern with orderliness or perfection, which in a lot of instances we actually think is desirable and rational. You know, attention to detail, okay, and things like that. So this is distinct from OCD, but there is some overlap genetically and from heritable perspectives because people that have OCD, I'm getting used to this new thing and I'm pushing the wrong button because I have a brand new one that I obviously haven't used before. Individuals that have OCD often have relatives in their lineage that either also have OCD or have OCPD type disorders. So again, these are distinct and not the same thing if you hear people talking about them. So again, when we look in humans, because a lot of our data has come out of humans when we talk about compulsive type disorders, there are genetic components for a lot of mental disorders. As I said, there are risk factors if there's a relative in your lineage that has the disease. There is some indication that childhood abuse, other stress-inducing events, and even infections can predispose people to the development of obsessive or compulsive type behaviors. So when we look at the pathophysiology or the neurobiology, what we know now is that individuals that show these type of patterns have an aberration in the connections between their frontal cortex and the basal ganglia. So this is called the corticostriatal thalamocortical loop, so CSTC loop. And I'll show you a little bit better of a diagram before. But again, this is a loop that goes between the thinking part of your brain and then your subcortical nuclei, like the basal ganglia and things. Those are involved in production of motor patterns and a variety of other things involved in learning, all right? So normally, again, there's a discussion and there's a balance between the information that goes up from the basal ganglia to the cortex and then the information that is passed down from the cortex to the basal ganglia. So when you look at individuals that have OCD, this chart's a little bit hard to read, but so here's your orbital frontal cortex and the anterior cingulate gyrus. The striatum's part of your subthalamic or your basal nuclei group, all right? There's a nucleus called globus pallidus, and there's just a subtype there because here's another globus pallidus, the substantia nigra, which is what is impacted when people get Parkinson's disease, the subthalamic nucleus. So they have what is called a direct pathway and an indirect pathway. And in a normal individual, these are balanced. The direct pathway initiates movement and activity and behavior, all right, motor patterns. The indirect pathway inhibits those motor patterns. So what's happening in people that have OCD is, and this is where this diagram isn't great, but this direct pathway is excessively strong, basically, and there is a weakness or dysfunction, if you will, in the indirect pathway. So once the individual gets engaged in a behavior pattern, this pathway would normally balance that out by inhibiting that behavior, allowing the individual to disengage, transfer to another behavior pattern that in that scenario might be more profitable and reinforcing. But because this circuit isn't working properly, the individual gets caught in this repetitive behavior loop, okay? So if we look at the neurochemistry that's involved some of this has come out of horses, but some of this, again, is coming out of humans and research animals, that we know the major neurotransmitter and hormone systems are the opioids, dopamine, and serotonin. So serotonin influences that indirect pathway, impulse control, behavioral inhibition. As we talk a little bit later, again, about some of the work that's been done in horses specifically, but also some of the theory about why some individuals are more likely to have this happen than others, we're going to come back more to the influence and how serotonin and dopamine help. So some of this information first came out through pharmacologic studies, because years ago we didn't have good brain imaging modalities to look at somebody with OCD and say, hey, this PET scan looks different, or I've got a functional MRI on this individual. So what we learned a lot, like I said, came out of drugs. So we started using things like Prozac and found out sometimes by accident that people that had these type of repetitive behaviors actually improved when they were put on those types of drugs. And so thinking in a very simplistic way, we said, oh, just like we did in dogs in the beginning, if you put them on Prozac and it changes serotonin, then serotonin must be the problem, right? And that is true. That is part of the problem. Of course, what we know now is these neurochemical cascades. It's a whole cascade of things, and sometimes when you put an animal or a person on a drug that affects this neurochemical, well, that triggers a reaction here, and a change here, and a change here, and it's this change that is actually causing the therapeutic benefit from the drug, not the sort of more superficial one. But we know about 60% of patients, human patients, respond to SSRIs, but that means 40% of them don't, all right? We also know that when you take dopamine agonists, cocaine, methamphetamine, and apomorphine, that stereotypic behavior goes up. This is one of the ways they trigger this in laboratory animals, okay? So we know dopamine's involved in that because it exacerbates the symptoms. We suspect opioids are involved because some of the original studies that were done looking at cribbing in horses, they injected or gave horses opioid antagonists, and some of those horses, their cribbing behavior reduced by like 85%. So in the beginning, when we looked at cribbing in horses, we said, okay, they respond to naloxone, then the problem must be that horses are cribbing to make more beta endorphins, and that's why they crib. And of course, now we know it's so not that simple, because the more research we do, as you're going to see as we go through this, is it really just becomes even more complicated, and we don't really have that many more answers than we did before. So we also know that some individuals, when you put them on NMDA antagonists, so NMDA works on the glutamate receptors, that their symptoms improve. So there's some impact that neurotransmitter system is having on compulsive type and repetitive behaviors also. So getting more now into the actual development, we a lot of times talk, and Erica talked about this a little bit, about these kind of approach avoidance situations. where animals get in these conflicted contexts where they're caught between two opposing behavioral reactions or, again, reinforcement or consequence contingencies. And so what we see some of these animals do is then default into a third or trigger into a third seemingly unrelated behavior that seems, again, out of context to that situation as what we call a coping mechanism. So, for example, in horses, we see grazing a lot. Like we see what we call stress grazing. They get in a situation where they're anxious, they start grazing, and we're thinking, well, I know he's not grazing because he's relaxed. Like nobody could be relaxed when, you know, the dog's charging at you or whatever. Or we see this a lot in cats where something stressful happens to a cat and the cat suddenly turns and starts grooming itself, okay? Or the dogs that scratch or lick their rear ends, okay? So we assume this is a stress reduction behavior. So here we have this, my sound seems to have disappeared though. So we have this little altercation over the fence. I'm going to play this again. And then this other chestnut horse goes, oh, I'll take a nibble on this conveniently located tree branch right here. And after they had that altercation, I don't think the horse suddenly went, oh, I'm hungry, you know, I'm going to start eating right here. So that's just a little example, again, of a displacement behavior in a situation of conflict or stress. So we do see repetitive behaviors due to medical issues. So neurologic problems, EPM in horses, you know, brain tumors in animals, different types of infections. So when we have what we appear to think is a true compulsive disorder in an animal, we consider that kind of a diagnosis of exclusion. So there's a wide variety, depending on the species, of medical conditions that can cause aberrant behavior patterns, and we don't have a test for compulsive behavior. Even with all the imaging studies that we have now, they're just giving us little bits and pieces of information that have not been able to be pulled together into some type of a comprehensive analysis or diagnostic test that we can use to say, oh, this one, you know, really does have a compulsive disorder, all right? But what we think happens in a truly behavioral sense when it isn't medical is that the animals get in some situation of conflict or chronic stress or frustration, and then they show one of these displacement behaviors, which is probably getting reinforced, or again, reinforced through this adduction phenomenon that I was talking about before. And when that behavior becomes reinforced enough, we use the term emancipated from the original context. But basically, the animal starts to show that behavior potentially in other situations, okay? And then it doesn't seem connected to an environmental stimulus necessarily. And we talk a little bit later, we're going to talk about reactive and proactive coping styles. We're going to talk a little bit more then about individuals that are more or less reliant on environmental cues for showing certain behaviors. And then we also know there's a genetic factor influence, not only in the type of repetitive behavior we see in horses, but also the onset. So, one of the articles came out 2013. This is not specifically about horses, but it's more of a theory, if you will, pulling information that we know from other species and people. And basically what they're hypothesizing is differences in coping styles and why some horses, you take 15 horses, you put them all in the same management style, the same breed, whatever. Well, why do these two develop cribbing and these other 13 don't? Or why does this one weave but this one cribs? Why does any animal get a stereotypy versus not? And one of the suggested reasons has to do, again, with their innate coping style, which is related to their personality, their temperament. So they've identified what they call, proactive and reactive styles. So proactive individuals have an active response to environmental stress. They try to control the stressor by either escaping, using some type of aggression, removing themselves, as I said. So there's some type of an active response. These individuals have higher dopamine levels in their brain, in their ventral tegmental area. So the nucleus accumbens is part of the basal ganglia complex that's involved in reward. They have higher dopamine levels in that part of their brain and lower dopamine levels in other parts of their basal ganglia, okay? These are the horses or the individuals that we say are going to show repetitive behavior or appear to show repetitive behavior. They also have differences in their serotonin level. When we look at what we call reactive individuals, which to me is kind of a, when you describe them coming out of the dog world where we talk about reactive dogs, like it's kind of a terrible label in a way, because whenever I think reactive, I think about some dog that's like, ah! And spazzing out. But in this discussion, reactive individuals are more passive. They don't actively try to control the environment and the stressor. And what it leads to is emotional disengagement and apparent depression, okay? So they have higher serotonin levels and lower dopamine levels. And again, if we know that serotonin is related to behavioral inhibition and impulse control, then that kind of makes sense. These individuals are seeking control and reinforcement, right? So one of the discussions, especially, a lot of discussion about stereotypies is about welfare, and when we think about animals that look like this, like these animals cause us a problem. It's obvious. We see the horse cribbing and weaving, but the horses that disengage, which half them do anyway, partly because of the way we train them, these animals may actually be suffering equal amounts of welfare concern as the animals that are acting out. And we're missing this whole group of individuals because they don't draw attention to their behavior because they're passive, okay? So when we actually look at equine stereotypies, we generally group them into locomotor stereotypies and then oral type related repetitive behaviors. So the locomotor, stall walking, head tossing, weaving are the big ones. Pawing, which probably isn't necessarily a stereotypy. It may be to that level in some individuals. And then the big oral ones in horses, of course, cribbing and wind sucking. There's controversy over whether wood chewing is really a stereotypy, because if you're chewing and ingesting forage, roughage, is that really an abnormal behavior? And then there's these other little ones that you see in a lot of the performance horses too, like the tongue chewing and flapping and the lip flapping and tooth rubbing and tooth grinding and things like that. So this is a, unfortunately, rather bad video of a wind-sucking horse. Wind-sucking horses look like they're cribbing, except they don't actually grasp a surface. They just flex the neck. They pull air into the esophagus. We don't seem to have very good sound, but. And then an actual cribbing horse where they grasp a surface and again flex the neck. And in some instances, again, they are pulling air into the esophagus, but not actually down into the stomach. Years ago, people thought that they were pulling air into the stomach, but our fluoroscopic examinations and evaluations have proven that that's not the case. So other types of things like the lip flapping. Okay. I'm sorry? she asked, what is the level of confidence that horses do the oral behaviors, that there isn't a GI diagnosis? And it's not high, but what I will say is that is one of the things that we specifically look for now. And we're going to talk a little bit about some of the research that shows, if this predisposes to gastric ulcers. If you treat some of these, say, with antacids, they get better. So some of them absolutely do have gastrointestinal problems, okay? So if we look at the incidence, depending on the country, the study that you look into, some studies, when they are looking at incidence of stereotypies, they lump all of them together. And some studies are separating out oral from locomotor, or they just look at cribbing or whatever. So Furio did a study and looked at all stereotypies together. They looked at two populations of horses, horses that were in a riding school, and then a poorly managed Arabian broodmare farm. And what they found is if they look at all stereotypies, 65% of the horses in the riding school had one or more stereotypic behaviors, and 24% of the Arabian broodmares had one or more stereotypic behaviors. So if we look at incidence of cribbing, for example, usually it's running around 2 to 4%, but when you clump all of them together, obviously the rates are higher. So we feel from studies and research, and again, that oral stereotypies, and this really isn't in refute, are related to foraging frustration, assuming it's not a medical problem, foraging frustration, diet type, and isolation. And again, we're going to go into some of these in more detail. And we look at locomotor stereotypies. They are associated with confinement, social isolation, and frustration. So for example, the horse knows it's turnout time, they're in their stalls, and some of them stall walk or weave in anticipation of being turned out. And you can certainly imagine how easy it is to reinforce that behavior, because if the horse starts pacing at the door of the stall, and then we come open up the stall and let the horse out, of course we are reinforcing a repetitive behavior, okay? So we're going to spend quite a bit of time on cribbing. This is where the most research is. There's a lot of research out, and when I set this up, I really kind of tried to focus mostly on things that maybe were new in the last 5 or 7 years. There's some new stuff, and some of it's helpful, and I'll be honest with you, some of it really isn't. What we do know is genetics plays a role. For example, thoroughbreds, especially racing thoroughbreds, have a really high incidence of cribbing. We know that cribbing is related to riding disciplines, so dressage horses, eventing horses, endurance horses in that order, meaning dressage horses has a higher incidence than eventers, than endurance. English riding discipline horses have a higher incidence of cribbing than horses that are in Western disciplines. I don't know why. Maybe management styles, again, looking at how they're housed. Certainly people that have a $100,000 FEI dressage horse and they're scared to turn it out with another horse because it might get kicked. Whereas, I don't know, maybe some of these people that have these Western horses, they just dump 30 of them out in a pasture together, and because they don't, I'm not saying they don't care, but sometimes the management style might be a little bit looser.
Wouldn't that be confounded with breed?
Yes. She said, wouldn't it be confounded with breed? And yes, to some degree, but some of these studies, too, when they look at statistical analysis, they are able to pull breed out of those other factors, okay? Confined housing is a risk, and we know that horses that are kept on straw bedding versus other types of bedding, like shaving, lower risk of cribbing, higher risk of cribbing. Gastric inflammation, so again, has been tied into gastric ulcers. Diet, we're going to go into diet and weaning method in more detail. So there's a lot of things that we know that are not in question. And one, we know that the way we wean horses and their diet is a major factor. So foals that crib, or that go on to crib later, show more oral behavior. They suckle longer than their non-cribbing or later cribbing counterparts. and generally have more oral exploratory behavior. Many of them start with wood chewing and then progress on to cribbing. 66% of horses that begin cribbing do it within 1 month of weaning. Abrupt weaning and weaning them into confinement or stalls increases the risk. And if you wean the foal onto concentrates, you increase the risk of cribbing 4-fold. So there are many studies that show there's a giant correlation between concentrate feeding, so sweet feeds and things like that, and the development of cribbing and the perpetuation of it. Like, that's not an argument. There's no controversy there as there is in some of the other stuff that we're going to go over. They are more likely to crib on twice daily feeding versus 3 times feeding. And again, as I said, if you wean them onto concentrates, you increase the risk. Cribbing occurs primarily postprandial, so after the meal. Locomotor stereotypies tend to peak pre-meal, or again, in anticipation of some event like turnout, all right? So Alberghini in 2010 looked at, again, diet and confinement. They found that stalled horses had lower serotonin levels. Of those horses that were, we also knew that animals on a high concentrate diet, but the stalled horses that were put on a high concentration diet, 11% of them developed cribbing, and they did it within 4 weeks of switching to that diet, okay? These correlations are very strong, as I said, across studies. So one of the theories was, does cribbing increase salivary production, and are these animals, because horses are designed to eat constantly. They graze constantly. Their GI tract is not meant to be empty. They are trickle feeders. So now when we manage them, we put them in stalls, or they go on dry lots sometimes. They're out on dirt pastures where there really isn't any grass, or they're in a stall. We feed them high energy foods twice a day. They get some hay. Some horses get free-fed hay ad lib, but many of them get a plunk of hay, and then they eat it, and then for X number of hours, their GI tract basically is empty, or their stomach is empty until the next feeding, okay? So one of the theories was that because the GI tract is empty and you're getting acid production, that maybe the horses are cribbing to produce the alkaline saliva that will then buffer the acid environment of the stomach and the hindgut, right? So one study implied that salivation increased, because salivation occurs in horses when they chew. They don't drool like dogs do, which is actually a really nice thing about horses. They don't just sit and watch you and start drooling. They actually have to be chewing, okay? But then there's also been a recent study that Dr. Haug did recently that showed there's 0 difference in salivary production between cribbing and non-cribbing horses. So that theory's kind of like, well, maybe, maybe not, all right? We do know some horses with cribbing have gastric ulcerations and inflammation. Like, we know that. And maybe I should go back to my old model. I'll get used to it. Treating some of those individuals, as I said before, with antacid does improve or abolish the cribbing in some individuals. But there are many of them, obviously, that it doesn't, because if it was that easy, we wouldn't have all this research. So one of the other issues with cribbing is this potential link with colic. And, again, for years, people were like, well, we wanted to stop horses from cribbing because we thought they were sucking air into their stomach, and then it was predisposing them to colic. And there is a correlation between cribbing and colic, but it is not necessarily causation, right? So Dr. Malamed did a study in 2010 and did find an increased risk of colic with cribbers, but not a particular type. But then Archer's study showed that cribbing horses were at increased risk for a type of colic called epiploic foramen entrapment, but not other types of colic. And so there probably is some correlation here, as I said, this is another study in 2014, 367 horses in the UK, 35% had colic. These were not all cribbers, by the way, and a mean of 5.25 episodes per individual, or what they call horse years at risk. I'm not a statistician, so what they found that put horses at risk for recurrent colic, not first episodes, was if they were cribbers, if they cribbed while they actually had access to forage versus horses that were deprived, horses that were fed haylage, which is kind of an early cut fermented type of grass that they, I guess, feed in some parts of the world, but not in my part of the world. And then horses that were stabled during autumn months, because horses colic, you know, is related to seasonal changes sometimes, okay? So the deal with the colic is these individuals that crib probably have some kind of general gastrointestinal derangement. And while the cribbing doesn't necessarily cause colic and the colic doesn't necessarily cause cribbing, there may be correlations there that are just telling us this particular individual has some kind of derangement in the GI physiology that we haven't identified yet that makes them susceptible to one or both of these problems. So as I mentioned before, one of the original studies looked at giving horses naloxone, or an opioid antagonist. And so that first study, like, there were dramatic results. Like, they gave the naloxone to the horses, they were like 85% better, and then we were like, aha, we know what's going on. And then people started following up with, you know, to try to replicate the study, and then we're like, oh, this doesn't work in every study. So looking at endorphin levels in horses that crib versus not, the results are completely mixed. I mean, like, there is no type of consistent correlation there. So you're sort of like, well, we don't know. It probably plays some role. It may play a role early in the process, but not as much after the behavior becomes entrenched, okay? I mentioned before that cribbing horses have alterations in their dopamine receptor density, higher in the nucleus accumbens and lower in the caudate nucleus, that obviously impacts perpetuation of the behavior. So there's also been a lot of studies looking at cortisol and the stress response axis, because obviously we think horses crib because there's some kind of poor welfare, and if that's the case, then shouldn't there be some kind of correlation between their stress hormones and whether they crib or not? And the shorter answer is no. I mean, some of the studies you look at, there is, you know, an elevation in ACTH in the cribbers, but not the others. And then other studies find no difference. So Furio looked at them and said found no correlation between cortisol and any type of stereotypy. Freeman in 2015 did an ACTH challenge and found cortisol increased in the cribbing horses more than the non-cribbing horses, but that change was dependent almost completely on this subset of horses. So when they looked at the cribbing horses, some of the horses cribbed during the test, and some of them did not. And the horses that didn't crib during the test, there was no change in their cortisol. The horses that did crib, there was no change in their cortisol, but the horses that did not crib had greater rises. But then other studies that look again at horses that are cribbing haven't found that type of increase. And we again don't know if that change in cortisol is the cause of cribbing, is it contributing to it, or again, is it a result of the fact that the horses didn't get to engage in this apparently coping mechanism. Hemmon's done a lot of research actually in cribbing, and one of their studies, again, no correlation between cortisol level and cribbing. And they've looked at both salivary cortisol, plasma cortisol, and fecal cortisol levels in these horses, and there's just no consistent change. So now they're starting to look at other hormones like ghrelin. Ghrelin is a hormone that stimulates gastric acid secretion to help protect the GI tract. It is related to feeding, okay? And so they said, well, is there a change in this? So again, Hemmen, 2012, looked at crib-biting horses, found that that set of horses had higher plasma levels of ghrelin than others. But then there's another study where they looked at ghrelin and they didn't find any change between the cribbing horses and the non-cribbing horses, okay? So then we're also looking at leptin. So leptin's the satiety hormone, which years ago, they identified this in mice. It was the big rage. It was going to cure obesity in people, and obviously that didn't happen. And so then they're like, okay, well, it affects consumatory behavior and appetitive behavior in individuals. Maybe it has a role in this. They have receptors in the salivary glands of horses. So there's been one study that's looked at this, and what they found is that the leptin levels were lower in the cribbing horses around feeding time, and there was a negative correlation with cribbing intensity, meaning the lower the leptin, the higher the cribbing. But again, that doesn't necessarily tell us what we're going to do with this piece of information. I mean, I guess we could inject all these horses with leptin, but maybe we should just turn them out and feed them differently too. One of the things that I think is really interesting about when I do all this research about cribbing in particular in horses and even weaving and things is we ultimately know what causes this in horses because feral horses do not show stereotypies. The Pryskowalski's horse does not exhibit stereotypies, the wild version of horses, until you bring them in captivity. So we know this is a management problem. We know it's caused by suboptimal housing and feeding practices in horses. We know that. But there's a lot of, I think, money being spent trying to find probably a Band-Aid so that we don't have to completely redo decades and hundreds of years of management practices because it's easier, of course, to try to fix the horse rather than the cause of the problem sometimes, which is really not the horse. So it's not that all this research isn't useful in some degree, because certainly if we can more define at-risk individuals, we can impact breeding practices too. So then we wanted to look and say, okay, is it the taste of the feed or something further down in the GI tract that is contributing to the cribbing? So Albright and her group did this cool little test study where they took 6 horses, cribbing horses, and they did 2 sub-studies, if you will. So first they fed them either grain, pure grain, or a grain solution, meaning it was diluted with water, or they fed them a sucrose and a fructose and a saccharin solution so they could actually eat it. The only meal that affected cribbing was the full grain meal, not the diluted grain meal. So it significantly increased the crib biting. But they had less response to the sweet solutions and very little to saccharin, and it's partly because the horses wouldn't even eat it, okay? So then they said, all right, now we're going to bypass the mouth, and they nasogastrotubed the horses, and they administered either a grain solution, which was like, they ground the grain up, mixed it with water until they could get it, enough water until they could actually pump it through the tube, which I think was like a 12% solution. And then they also had a fructose and a water solution. So they pumped this into the horse's stomach. There's no difference in their cribbing rate between any of the solutions. So that gives us a little bit of evidence that there's something about the taste in the oral cavity that is contributing to the cribbing. But of course, then there's all the things that may be happening further down in the GI tract, where they ferment in their hindgut and things like that, But again, still other pieces of information. So when we look at cribbing treatment, prevention's the key, because once most of these cribbers, again, it's entrenched, is a very poor prognosis for resolving the behavior once it's established. But what we try to do is increase forage, reduce the concentrates, the sweet feed, reduce starches, and increase turnout time, put them on straw bedding if you can, and give them social contact with other horses. There are a variety of anti-cribbing devices out there. So the most common one are the cribbing collars, which in various ways prevent the horse from flexing their neck once they grab to be able to kind of draw the air in. So here are two different types of cribbing collars, putting muzzles on them so they can't grasp the surface in order to engage in the behavior. There's been a lot of controversy over whether these actually worsen the horse's welfare, because again, if the animals are using this as a coping mechanism and you remove that ability to do that, are we worsening their welfare? And the reason people want to stop them is they think, one, maybe they won't colic, but also to reduce tooth wear. And some of these horses, when they do it enough, they get abnormal muscular development in their neck. So there are, I guess, other welfare and performance concerns for people that they want to stop it. And plus, it just has such a negative connotation now. People just want to make them stop, you know? So one of the things they've looked at to try to test that theory are what they call rebound studies. So if you put an anti-cribbing device on a horse for a period of time and then you take the device off, will the animal show an escalating frequency or intensity of cribbing because they were deprived of the behavior for X amount of time? And again, that's controversial because some studies have shown rebound and some have not. So other types of devices that are out there, of course, shock collars, because we can put shock collars on anything. And then there's this nice little device. These are called cribbing rings, which are basically little metal prongs that go over the teeth and embed in the base of the gum so that when the horse grasps a surface, it causes a lot of discomfort. So this was a project that Janine Berger, she's one of the other boarded veterinary behaviorists, little pilot study she did back in 2009 with a product called a Happy Halter. And this is electrotherapy stimulation. There's a little device here that hooks onto the halter on the temporal region of the horse. And they treated these horses daily for 6 weeks. I think it was like a 20-minute treatment, and graphed the horse's cribbing rates. And this never got published in like a, peer-reviewed journal or anything. It was just one of these things somebody does and they personally communicate the data. She presented it at a meeting one time. But the results were actually quite encouraging because all of the horses, if I remember correctly, showed a pretty significant reduction in their cribbing rate. And that persisted for some time, even after the treatment ended. And I don't really know why nobody's followed up on this, because it certainly seems like a much more humane approach. And it also seems like it would be fairly easy for people to implement, like when they hook a horse into the cross ties to groom it, you run the device, it just seems like it wouldn't be that big of a, that intrusive into somebody's life to try to treat a horse this way. But I have not been able to find any kind of follow-up research on this product or this concept.
Is it helpful because of the area of the brain? Is
Yes.
it stimulating like the frontal cortex? Or?
I don't know what specific area that they were trying to stimulate, and I don't really know that much, to be honest with you, about transcranial stimulation in general. So unfortunately, I can't answer that question. So then if we look at weaving, weaving's a frustrated motivation, again, related to confinement and social isolation, feeding anticipation and turnout, as I mentioned before. Other types of locomotor stereotypies are stall walking. And let me see if I can go back. And this is just another kind of a confinement, almost a stall walking, but a bigger area. And you can see this horse has also developed this kind of stereotypical head flip.
If you want to move toward the barrier, you can, Taylor.
So again, we know that weaving is highly related to social isolation and confinement. Again, not only are horses meant to eat all day, but when they eat, for those of you who have actually watched a horse graze, they take a bite or two, they take a step, and they take a bite or two, and they take a step, and they take a bite or two. So they walk constantly while they're grazing. They have been documented to take up to 10,000 steps a day just from normal grazing behavior. So not only do we mess with how we feed them, but now we've also taken them in many instances and put them in 10 or 12 by 12, horse cages, stall them for long periods of the day, and we've, again, eliminated that kind of constant walking that they are accustomed to doing. So what we do know is that weaving decreases with, again, social companionship, visual contact with other horses. Danny Mills did a couple studies where they tried putting mirrors in stalls, and that reduced weaving, or even hanging a poster of a horse on the side of the stall, and that reduced weaving behavior as well. Those two particular studies were not done for a very long time. I think they only did it for about 4 days, but still, again, when we change management and we take horses that cannot see or contact other horses and alter how they're stabled, like maybe opening windows or things, or housing them across from another horse, we see some of these locomotor stereotypies subside. So how do we treat the locomotor ones? Again, more turnout, social contact, exercise reduces stereotypies. And then with some of these locomotor ones in particular, like pawing, even weaving or stall walking, especially in anticipation to things like feeding, you can actually train an incompatible behavior, because in the general, usually these animals, as I said, are getting reinforced somehow because they're showing this in anticipation of some type of reinforcer, and if we can alter that contingency, then we can train a different behavior. Cribbing's much harder, obviously. So the other one we're going to go through really quickly is head shaking. And this is a repetitive behavior where they flip the nose vertically, or sometimes have a rotational twist of the head. Oops. And then here's just a different version. So there's a lot of etiologies for head shaking. These can be, depending on when the horse is exhibiting this. So for example, if the horse does it primarily under saddle, then we definitely have to look at things like tack fit, dental disease, rider issues, like how do people handle their hands on the reins, saddle fit, anything like that that makes the animal uncomfortable. And then there's a number of medical things like viral infections, potentially, allergic problems, insect allergies, and irritation. Equine protozoal myelitis has been associated with this in some conditions. And then the big category, which is a little bit easier to test for, is what they call photic head shaking, which is similar to photic sneezing in humans, where when they're exposed to bright light, what they expect is happening is that there's an irritation along the trigeminal nerve, which is causing painful or annoying kind of sensations. The trigeminal nerve innervates the side of the nose, and that these animals, due to the bright light, are experiencing basically paresthesias, alterations in sensation that are causing them to want to rub or flip their nose. So these horses, as I said, are a little bit easier to test, because if they don't ever do it in the dark, and then you put them in bright light and whammo, they do it, then we can probably surmise that it's mostly a photic head shaking problem, which doesn't always make it easier to treat. So address underlying tack, rider, et cetera, medical issues, pest control instead of if that is part of the problem. And then for the photic head shakers, riding them at night or under cover, They also have these commercial face masks and light blockers, like little blinders, that you can either ride the horses in or just use to turn them out if you can't turn them out at night. And then there's a whole variety of course, other interventions that have been tried with varying success. Acupuncture, craniosacral therapy. I put this one in parentheses because I came across it when I was investigating this problem, but it's one of these, cure-all things, like no matter what the horse's problem, that if you give them this, apparently it's quite expensive, that the head shaking will go away. But cyproheptadine and or carbamazepine have the best treatment success so far for photic head shakers, and one or both of those drugs combined can cause an improvement of up to about 80–85% in a number of horses. But even light blocking is quite successful with the photic head shakers. So how do we work with these all together? So one, select breeding stock carefully. So this is where some of this research may really help us, because again, if we can identify that, say, horses that have this ghrelin or leptin pattern or whatever are more susceptible to developing certain stereotypies, then we can do some selective breeding for that to basically help the horses mold to the management style that we have imposed on them. Definitely we can impact their weaning, so natural weaning if possible, and if not, gradual weaning versus abrupt weaning, weaning them onto pasture versus in stalls, weaning them in groups instead of in isolation, and definitely weaning them onto hay or grass and not onto concentrates, because the concentrate is a big deal in triggering the cribbing behavior at least. And then forage. Again, these animals were designed to eat constantly. That's always one of the things that as a positive reinforcement trainer for horses too, that it's kind of always ironic that people don't want to work food with their horses, but then the horses are designed to eat constantly. So in a way, they're the perfect subject for this kind of training. But lots of forage, reducing their concentrates, offering multiple types of forage, because again, in the wild, horses adjust their eating habits based on the forage that is available during that season. And again, when we put them into domestic management, we kind of tend to pick one kind of hay, and they get that kind of hay every day, year-round. So giving them more choice, but also more variability in nutritional content may be quite helpful. And then trying to find ways to increase feeding duration so that, again, we kind of get this trickle feeding effect instead of the big, dump a bunch of food, eat it in 5 minutes, and then go hungry. So there's a growing market for feeding enrichment toys in horses and other types of feeding strategies to try to increase the duration of their feeding time or their feeding behavior. And then one of the other things that also comes up frequently with stereotypies in horses, particularly cribbing, is this idea that they are going to learn it from each other, so that if you go board your horse in a stable where there's one or more cribbers, that your horse is going to learn to do that. And there is zero evidence to date that horses actually learn cribbing or any other kind of stereotypy from each other, which again, if you think about it from a physiologic perspective, I'm not going to learn to become an obsessive compulsive hand washer because I watched my friend Terry have that problem. Like, that's not the way it works. Right, I know, she doesn't have that problem, just to identify that. She has other problems, but so there is a genetic and a physiologic susceptibility to this, that just like people with depression, not everybody gets depression, but people that have the right serotonin transporter allele and have the right early environmental experiences are more likely to be set up to develop clinical depression. Not everybody's going to get it, and the same thing's true with the horses. And again, you don't learn that kind of pathology from another individual. And that's all I have. If anybody has any questions. Thank you.
Thank you for the somewhat, I think, distressing talk. I'm very sad about everything. I was really struck by what you said, that you didn't see any evidence of horses exhibiting stereotypies in the wild or in kind of non-human type situations. And that struck me as really spectacular because it seems like in other species you do see, I mean, of course in the zoo setting or captive settings you see higher level of stereotypy, but you still see some level of stereotypy in the natural populations as well. Is this, for cribbing, is it the case that it's kind of a special situation where it is purely controlled by the environmental kind of, what we impose on them through this environmental constraint?
Yeah, her question and her comment was that, you know, we state that we haven't seen these stereotypies cribbing, but also some of the others in horses in the wild. She says certainly we see them in zoo animals and things in zoos, but apparently, because I don't know about a bunch of zoo animals, apparently there are other species where stereotypies do occur in natural, unconfined settings, if I'm interpreting what you said correctly. And does that mean that in horses this is all environmentally controlled? And I would guess two things, which is one, perhaps, because I certainly don't have all the answers. Two, but then also, is it possible that there are populations of horses where we haven't seen it, but maybe it's happening? You know, there's certainly been, I think, quite a bit of research on a lot of the feral horses, looking at the Mustangs and the Carmark horses and things like that. So I think somebody would have noticed those if they were occurring, because there has been enough study looking at those animals in natural environments. So why there's a difference between those and some of these, whatever other species you're referring to, I don't know, unless it's partly genetic. I don't know. I don't have a complete answer to that.
I'm curious specifically about the photic head shaking, because that does seem so physiological. Is that due to breeding?
I think they think there's a genetic component, and interestingly, they don't show it when they're young. They tend to develop it kind of like middle-aged and adult. And if I remember correctly, it happens more in geldings than mares. So there probably, again, is some genetic sensitivity, but I don't think anybody knows. There's really not a ton of data on head shaking. But I don't think anybody really knows why some of them ultimately get it. Just like, honestly, we don't really know ultimately why some horses crib and some don't.
I just wanted to mention about head shaking. I don't have that, but my horse started emancipated behavior with head shaking, which was really interesting in that it's a frustration behavior for him, head shaking, and when he's frustrated with me, he will head shake, and it is tell before he bucks. So I've learned, he's taught me, really, he has taught me, I'm frustrated, and I'm like, well, what am I doing to frustrate you?
Yeah.
So it's really interesting. I could imagine that if I didn't listen to him as much as I do, that could escalate very quickly.
Right, and certainly, so she said her horse has a frustration-induced head shaking, and certainly not all of these head shakers are photic head shakers. And there's a variety of things. My gelding, when I ride and he gets a little bit stressed, he does the nose rubbing thing, which you probably saw, but there's not an actual head shaking. So there may be, again, multiple causes, and they're not all compulsive type or this photic, and that's why it can be difficult, some of the horses, to find out exactly what's going on.
I was wondering if you've seen any effects of hormones in horses affecting these behaviors. We've just noticed at our farm that there's some differences with mares that exhibit these behaviors when they're in heat versus not in heat. And have there been any studies that have looked at the effects of hormones?
She's asking about the effects of basically reproductive hormones on stereotypic behavior, and I'll be honest with you, I can't recall if I came across that while I was reading some of this. I know that there have been some studies looking at reproductive efficacy in horses that have stereotypies, and they do have reduced reproductive fitness. But I don't recall if I came across anybody that's looked specifically at whether during different parts of their cycle, their reproductive hormones influence the frequency of the behavior. Sue, what? Oh, way in the back, sorry.
Back to the cribbing, I can count on both hands the number of horses that I've encountered when we're removing cribbing collars, and that at the moment that you remove the collar, they go from 0 to 1 to 11, to where it's like you let the air in all of a sudden. I didn't know if there's any correlation there with the cribbing collar being on and knowing it's coming off.
So you mean, when you say 0 to 11, they're doing what?
They're calm, they're under threshold, and then the moment the buckle is unloosed and they can feel the cribbing collar come off, they're exploding.
Like exploding?
Breaking loose and running and bucking and hopping, and literally over threshold, completely gone from 0 to 60 in 0.4.
I haven't come across anybody that's documented anything like that. I mean, again, some of these studies, they looked at rebound, but nobody that is documented, super aroused or explosive type behaviors. And I wonder, what we do know is, because when they look at some of these devices and look at cortisol levels and things wearing the devices, and they put them on normal horses and they put them on cribbing horses, is we know just the act of wearing the device raises their cortisol, whether they're cribbers or not. So I suspect that may be the thing. You've probably actually felt some of these. Some of them are quite tight. And I look at them and go, man, I'd be uncomfortable wearing that. So if somebody took it off me, I might be like, woo, also.
You speak about nourishment as a therapy to help the horses. Do you think it's useful to let the individual having the stereotypy and try to shape in a different behavior, but again stopping the stereotypy? Do you think the therapy who consists to stop the stereotypy behavior is bad? I saw a paper of Simon Gadbois, I think on this one animal, and they were like, the worst thing you can do is try to stop the stereotypy behavior.
Yeah.
And so let the individual, and you can even use as reinforcement, like the stereotypy behavior start to be a reinforcement for a target, another target.
Yeah, so he's basically, well, one, is it bad to stop the behavior? And there's, again, a lot of controversy over that because if it's a coping mechanism. But certainly, I think for some of the behaviors, especially the locomotor stereotypies, absolutely give them an alternative way to get the same functional outcome. And if you do that, you shouldn't be creating additional stress by stopping the stereotypy because the animal's still getting the same functional outcome. The problem with cribbing horses is we don't know what the functional outcome is. But the other stereotypies, absolutely. If I had a horse that was, if I had a horse that was weaving or pawing or whatever, I would absolutely try some type of different arrangement to teach an alternative behavior. Yeah.
Two things. Is there any, like with cribbing, you were saying that like the geldings, it was more common than a mare. Is there any preferences like that for weaving or other stereotypy behavior?
So I think just to clarify my comment was that the head shaking seems to be more common in geldings. I don't recall, and there could be, but I don't recall off the top of my head if there was a sex variation for cribbing. I do not recall seeing sex variations for things like weaving or the locomotor stereotypies.
And the other thing that I was curious, I'm wondering if, and if what your thoughts are on, is it possible that because horses are prey animals, flight animals, that they're more sensitive to our pressures that we put on them when we confine them instead of them being out in the wild where they're not confined, they're grazing, they're foraging, they're walking, all of the things that we kind of take away from them? Would they be more sensitive than, let's say, like she was talking about, wildlife, that they don't seem to have, there's not a difference?
Yeah, she's asking, because horses are prey animals, does that make them more sensitive to the environmental restrictions of the way we manage them now? And I would surmise, and again, I don't know this for sure, this is my thought, which is that probably the level of stress induced by the management is dependent more on their natural behavior patterns versus whether they're prey species or predator species. Because if you have a prey species that lives in a very limited area, has a limited foraging, range, then putting that animal in a small environment isn't going to be as stressful as if you have an individual that, in the general course of its natural behavior, ranges out over long periods of time. So like, I don't know that much about sloths, but if people in here know anything about sloths, I'm just assuming sloths don't move much. So maybe, confinement to a sloth isn't as stressful as confinement to a horse or a tiger or a ground squirrel either, because they range over huge amounts of area too. I think it's more their behavior pattern.
Thank you. You speak a bit about pharmacology, drugs.
Yes.
Your point was like, we know it can be useful like Prozac, fluoxetine or Xanax, benzo, but your point was like, if we stop the treatment, the stereotypy is coming back?
So to make sure I'm understanding your question, if you put a horse, say, on SSRI or something for a stereotypy, and then you stop the drug, is the stereotypy going to come back? Okay? And potentially, yes. I would say probably if you were looking at cribbing, again, because of how deeply entrenched that particular behavior comes, and drugs aren't terribly effective for cribbing anyway, but if it was a responder, I suspect that you would get relapse if the drug was withdrawn, unless there is some underlying problem like a gastrointestinal problem or gastric ulceration or something that you are able to effectively address. And the other thing is we look at duration of therapy too. Sometimes if they're on long enough and you have created new patterns of behavior that are stable, then sometimes those individuals, at least in veterinary perspective, I don't know about people, can sometimes more successfully be taken off. The longer they're on, the more stable the new pattern is, then you might get those individuals off the drug successfully without relapse, but it really is highly dependent on the individual.
I was curious about the effects of routine and on stereotypic behaviors. What you would recommend, whether it's better for horses that display these behaviors to have a consistent routine, where they know it's going to be feeding time before, so they're going to start displaying the behavior, or it's better for them to try to change when you feed so that they kind of don't really know.
I don't know that she said, what's the effect of routine on the stereotypies? And I don't really know that anybody's identified any kind of significant influence on routine other than what the consequence is. So again, if you have a weaving horse and they're weaving because the food wheelbarrow is coming down the aisle, then it may actually be beneficial to roll the wheelbarrow down the aisle a whole bunch of times and not feed the horse, and then feed the horse when he's not weaving, and so in that instance, changing up the routine would be beneficial. I don't know that it would have any impact on cribbing, actually, because cribbing really seems, in the beginning especially, to be so initiated by the act of eating and what we're feeding, that I don't know that if you suddenly switch their meals around, they're still going to crib after you feed them,